Yeah, we can start.
Yes, ma'am. Chatil will give us a signal to start. Yeah.
Yeah.
Sir, we are in live. Good to go.
Thank you. So good evening, ladies and gentlemen. On behalf of Pune Psychiatry Association and IPS, I welcome all of you for today's event on women's mental health. So with this, I hand over the session for further proceeding to Dr. Madhumita. Yeah, ma'am, please.
Yeah. A very good evening to all. On behalf of the Pune Psychiatric Association and the Indian Psychiatric Society Pune branch, I welcome all our friends from different women organizations who have joined us today in large numbers, and those who have come in individual capacities, and our mental health professionals as always. We wish you all a very happy International Women's Day in advance. We are pleased to meet you all, friends, on this platform today to communicate with you on a very important aspect of a woman's life, an aspect which all, including ourselves, have always ignored and never given up importance to. But this is one aspect of our overall health that is extremely important because it determines the very quality of our living and our life experiences. This is the aspect of mental health. How many of us have actually given a thought and realized the importance of our own mental health? I'm sure not many. We live in a country and society where women's overall health and status has always taken a backseat. So the women's mental health well-being is of course a far-fetched goal. But my dear friends, we must realize there is no health without mental health. Our physical health will suffer if our mental health is not at its best. Social health is lost if mental health is not good, and emotional health will also go for a toss if mentally we are not in a good state. If we want to be totally healthy, our mental health must be given utmost priority. ख्वाहिशें तो आज भी बगावत करना चाहती है, मगर सीख लिया है मैंने हर बात को सीने में दफन करना. We have been taught as girls and women not to express, not to exhibit feelings, aspirations, aims. Keep burying them all. And down goes our mental health well-being also. This leads to emotional chaos, emotional outbursts, confusions, indecisiveness, poor confidence, and dissatisfaction in life. What does this lead to? If this is not taken in the right perspective, this all leads to anxiety, worries, depressive thoughts, guilt, irritability, mood changes, and disrupts the life of a woman and ruins her happiness. We must know, friends, that anxiety, depression affects a large number of women in our society. So let us now today understand why and how all this happens. Let us understand, more importantly, how we can prevent the severity of all this in our life. We must develop healthy minds. We must develop healthy attitudes, gain knowledge, and then we will not fall prey to mental illnesses. Yes, we can all do it. To enhance our mental health and enrich us today with their knowledge, we have two very eminent psychiatrists, Dr. Swati Joshi and Dr. Manjiri Datar. Dr. Swati Joshi will tell us what all the challenges a woman faces at every stage of her life, from girlhood to womanhood, from menarche to menopause, and how to maintain our mental health during all these times. Our second speaker, young and dynamic Dr. Manjiri Datar, shall speak on mental health in young women with special focus on marital and obstetric issues, two very important aspects of a woman's life. And we have with us two very intelligent women psychiatrists of Pune, my dear friends, to chair this program, Dr. Jyoti Shetty and Dr. Smita Panse. I now request the Secretary of Pune Psychiatric Association, Dr. Sandeep Mahamuni, to kindly formally introduce our eminent chairpersons. Thank you and welcome you all again. Sandeep?
Yeah, thank you, ma'am. So here I welcome our first chairperson, Dr. Jyoti Shetty, ma'am, to this session. Dr. Jyoti Shetty, ma'am, is a prominent face in the psychiatrist circle in the city. She is professor and head, Department of Psychiatry, Bharati Vidyapit, Deemed University Medical College, and Bharati Hospital and Research Center, Pune. She is the member of Institutional Ethics Committee of the Bharati Hospital. She is also a member, Medical Education Unit of the Bharati University. She was convener of Child Psychiatry Subcommittee of Indian Psychiatric Society in 2015 and 16. She was also she is a convener of Forensic Psychiatry and Law Subspecialty, IPS. And she was president of Indian Psychiatric Society Pune branch in year 2016 and 17. And she had a lot of publications, national and international publications, to her credit. And now I hand over the proceedings to Shetty ma'am. Welcome, ma'am.
Thank you.
Dr. Sandeep, I think you should introduce the second chairperson also.
I guess I will introduce at the time of second speech.
Okay.
Yeah. Yes.
Okay. Yeah. Thank you very much, Dr. Mahamuni, and thank you, Dr. Madhumita. Welcome all the delegates who are listening in today. It is my pleasure to attend this program as a chairperson, especially in advance of the International Women's Day, which will be on Monday. And it's my pleasure to introduce my friend, Dr. Swati Joshi. Can we have her CV, please? Dr. Swati Joshi has been a colleague and very good friend for several years. She is a very prominent psychiatrist in private practice. She was also briefly attached to a medical college. She's done her MBBS MD from the NHL Municipal Medical College, Ahmedabad. She's been in private practice in Pune since 1996. She's currently working as a consultant psychiatrist at Sneha Clinic, Kothuru, and is an honorary consultant psychiatrist at Dinanath Mangeshkar Hospital. She worked as an assistant professor of psychiatry at BGMC Pune and then at Maima Medical College, Talegaon. She's currently the HOD and associate professor of psychiatry at Maimar Medical College, Talegaon. And she's also presented several papers at the national and regional conferences. She has 5 publications, and she contributed to the pregnancy helpline of Dinanath Mangeshkar Hospital. So today's talk by Swati Joshi will be on women's mental health from menarche to menopause. So I welcome Dr. Swati Joshi and invite her to start the talk.
Dr. Swati, you have to be unmuted. Dr. Swati Joshi, please unmute yourself.
Am I audible now?
Yes, yes.
Okay. So should I start to share the screen?
Yes, please.
Hello. Yeah. So thank you, Jyoti, for this kind introduction. I thank Pune Psychiatric Association and IPS Pune branch for giving me the opportunity to talk on the women's mental health. Today's talk is aimed to create the awareness about the various aspects of mental health in the society. So myself and my co-speaker, Dr. Manjiri Datar, will be talking on this subject. So I have divided my talk into two aspects. One is I will do brief introduction about what is mental health, and then about the women's mental health. So as all of us know that according to WHO, health is a state of complete physical, mental, social and spiritual well-being, and not merely just the absence of illness. And mental health is related to the state of well-being in which individual realizes his or her own potential, ability to feel, express and manage positive and negative emotions, and can cope with normal stresses of life and work productively and fruitfully. So thus the mental health is related to the promotion of well-being, prevention of mental disorder, and treatment and rehabilitation of the people affected by mental disorder. If we look at the mental health, there are basic 4 dimensions of mental health: thoughts, emotions, behavior, and body reactions. Mental health is prominently affected by our thoughts and emotions, and consequences, our reactions and behavior changes. So when we think something positively, or like I can do this well, or it is manageable, then I am feeling happy or contented, and then my body reactions will be I'm in a relaxed state, and my behavior is confident. The same thing when I think negatively, means if someone thinks negatively, then the emotions will be anxiety or depression, and the body shows negative reactions. So as we all experience various daily hassles or life stresses, which causes some mental distress or ill health. If we dealt it properly in a positive manner, then we come back to our normal positive mental state. But if we are unable to deal it properly, then it may end up in some kind of mental illness, like anxiety or depression. So the positive mental health can lead to increase our productivity, increase our satisfaction and happiness, and better physical health, family health, and social life. So why the mental health of women is important? As all of us will agree that women need to play various roles and lots of responsibility as a mother, wife, daughter-in-law, sister, and so on. And if she is working, then she has to fulfill her that duties also. So as a homemaker, she needs to take care of so many things, and she is the backbone of the family, and she is having also nurturing role, and which produces lots of stress on her. So you can imagine if the female woman is not in her good mental state, then what the condition of that house would be. Studies have proved that if the mother is not in a good mental health, it has a negative impact on the psychological health of her children also. That's why it is said that Mansik Swastha Nari Sampurna Ghar Tari. Due to internalizing tendencies of a woman, women are at a high risk of certain mental illnesses like anxiety, depression, post-traumatic stress disorder, or somatization disorder. If you look at the causes for the mental illness or mental ill health, various causes like biological causes and psychosocial causes. Among the biological causes, various brain neurotransmitters when its level get affected or it decrease in serotonin, dopamine or norepinephrine, it may produce anxiety, depression, and if increased dopamine level, then it may produce psychosis also. In our country, lots of women are malnourished, and because of the menstrual issues, they are because of malnourishment and menstrual issues, they have anemia and multivitamin deficiencies, which may also make them more susceptible to the anxiety and depression. Reproductive hormone like estrogen plays a very crucial role in the mental health of a woman. We will see it later on how it affects the woman's health. Studies have shown that the thyroid issues also play a great role in the mental health of any person. As we have seen that stress is the major cause of mental ill health or distress, and sometimes person may, if not able to deal it with properly, may end up in depression. There are various social causes also due to which women are at a higher risk. Like, as a woman's primary role is childbearing and child rearing, and also the caring and nurturing of the family, old and sick family member and other members in the family. She has a lots of stress and burden due to it. Still in our society, there is inequality between male and female child, more preference for male child, then practice of dowry, domestic violence, physical and sexual abuse, joint family system, low autonomy for decision making. All this produce negative impact on the mental health of a woman. Nowadays, we come across so many women from the urban area in mid 30 or 40 who come with depression as their grown-up children no longer require their constant supervision and constant supervision or help, and now they have lost their ability and confidence to work in their profession due to a long gap in career. And as they have left the career because of children, but now the children no longer require them, and then sometimes they land up in depression. So now we will see what are the female hormones have an impact on the woman. During the menstruation, initially there is a gradual rise in the estrogen level till ovulation. After that, gradual fall in the estrogen hormone. And during the second phase, that is a luteal phase, gradual rise in the progesterone hormone, and then sudden fall in the both estrogen and progesterone at the onset of menses. So what does the estrogen do? Estrogen have an impact on the serotonin. When there is estrogen is in enough amount or high state, then serotonin is also the normal state. But when there is a estrogen goes down, then there is a low serotonin function, and which produces the low mood in the female. So menstruation is a menarche is a beginning of menstruation, and usually it starts at the age of 12 to 15, but sometimes nowadays as early as 8 years. Issues related to this young woman will be talked by Dr. Manjiri Datar. So I will not go in detail about it. I will give few cases so we'll understand how the female present during the phases of menstruation. A 30-year-old working woman presented with the complaint of often on increased irritability, anger outburst, increased emotional sensitivity, depressive feeling, fights with family member on trivial matters, realizes her mistakes later on and feel guilty. Mostly these episodes were during few days before the onset of menstruation. In between episodes, she was reasonably normal. So what was it? As it is a premenstrual syndrome or premenstrual symptoms. Here, due to drop in the estrogen level, many female experience various psychological and physical symptoms. Psychological symptoms like mood lability, anxiety, irritability, sensitivity to rejection, sense of feeling overwhelmed, and physical symptoms like lethargy, fatigue, sleep disturbances, appetite disturbances, abdominal bloating, breast tenderness, muscle aches and pain, etc. This all is because of low estrogen, low serotonin, and depression. Not all women experience this, but 20 to 30% of women experience premenstrual syndrome, and out of which 3 to 8 have a severe form of premenstrual symptoms, which is known as premenstrual dysphoric disorder. So in such cases, they consult us and they improve with lifestyle management, antidepressant, and along with the gynec consultation. 53-year-old female working as a manager having irregular and heavy menses in last 7 years, but more since last 2 months came for consultation with complaints of feeling low or depressed, loss of interest and enthusiasm, poor attention, concentration and focus, makes mistake in work, reduce grasping. She told me that I used to do lots of multitasking, but nowadays I make so much silly mistake that I am afraid to work, because she's working in the bank and she had lots of responsibility. So she lost her confidence, and due to this, she is on leave. She says that till I am okay, I am not going to join. Along with it, there are complaints where feeling stressed out, disturbed sleep and appetite, bloating sensation. Another features were her sugar level were fluctuating. On investigation, her hemoglobin was just 9 mg/cent and blood sugar was 190, low B12 level. All these were because of her perimenopausal symptoms. Perimenopause is a period between the onset of irregular menstrual cycle, and it lasts for many years, sometimes around 8 to 10 years. It is because of fluctuation in the reproductive hormone, that is estrogen level decline, and so the female experience such symptoms. Another features are menopausal symptoms. Here there are some patients like 54-year-old working woman achieved a menopause, 1 year presented with the complaint of low mood, irritability, fatigue, loss of interest in her teaching work, disturbed sleep, worried about kids who are planning to go abroad for further studies, decreased libido, painful sexual act, weight gain, increased dispute with the spouse. These all complaints were because of her menopause. Menopause is a permanent cessation of menstruation. If any woman miss it for 12 months, then it is declared as she is achieved menopause. After achieving menopause, there is no estrogen, so low serotonin and norepinephrine, which might be the cause of depression in some women. There are lots of symptoms. Depression and menopausal symptoms overlap, and in such female also, the treatment with treatment they improve. So now we'll see what is the depression and what the statistics says about depression. Around 322 million people are suffering from depression in the world, out of which 56.6 million are suffering from depression in India, and out of this 56.6 million, 38 million are female. Incidence of depression is around 7.5%. Male to female ratio is 2 to 1. So twice number of female are affected by depression than male. So what are the symptoms of depression and anxiety? All of us experience anxiety or depression sometimes in our life. It is a very common feature. So it doesn't mean that every one of us need a treatment, but this anxiety or feeling anxious or depressed are the normal mood variation of any human being. But when it lasted for longer period of time and it interfere with your day-to-day activity or working, then that person will need a treatment. So various features of anxiety are palpitation, increased heart rate, uneasiness, increased breathing rate, breathlessness, nausea, vomiting, butterfly in the stomach, then sweating, trembling, excessive thinking, lots of worries, difficulty in concentration, like that. And various symptoms of depression are feeling sad, depressed, dejected, anxious, angry, or irritable, mood swings, feeling of hopelessness, helplessness, or worthlessness. In our country, many patients come with some somatic complaints like chronic fatigue, lack of energy, aches and pain, headache, etc. Here, withdrawal from the family members or withdrawal from the social activity is very common in depressed patient. Then sometimes crying spells are very common. Patient may become suicidal. Patient may become indecisive, loses his confidence. So these are all the features of depression. So depression and anxiety can affect your quality of life in several ways. Physically, by disrupting your eating and sleeping pattern. Psychologically, by reducing your motivation and increasing feeling of worthlessness. And socially, by affecting your relationship. We are seeing that many patients, because of depression, their physical health goes down. Their motivation goes down, so their performance also get affected. And because of depression, they don't mix with the people or avoid people. And that's why, or sometimes because of irritability, they fight on very small issues, and then the relation become disturbed. So timely treatment for the same can help to improve your quality of life and prevent worsening of the coexisting medical conditions like diabetes, hypertension, etc. We are seeing many patients of diabetes or hypertension or any other chronic medical conditions. Their symptoms get worsened because of depression. So timely treatment of depression can prevent worsening of such medical condition also. So what are the tips for positive mental health? Exercise is essential because exercise produces certain hormonal changes, like it increases the endorphin level, which is considered as a happy hormone, and thus it helps in improving your depressive feeling. Balanced diet is also important because many times patients of malnutrition or anemia or vitamin deficiencies may mimic the symptoms like depression. And in depression, if these conditions are not treated simultaneously, then also the depression won't improve. Sleep hygiene is also very important because disturbance of sleep is also one of the symptoms of depression, but many times sleep disturbance may be the cause of depression in certain patients. Build a positive relationship. You must have someone to whom you can share all your feelings, and it also help to improve your mental health. It is very advisable to avoid addictive substances, particularly when you are using it to deal with your stress and depression. Then there are high chances that you will hook into it. So avoid any addictive substances like smoking, alcohol, etc. Which will, on avoiding it, it will help to improve your mental health. To improve your mental health also, you should identify and use your strength, and you should work on your weaknesses. That will also help in a positive way. Also take time for yourself, develop some hobby which you like, and so it will also give a enjoyment in your life. Spot your early warning sign, which is very essential, because if you treat your issues very in early stage, then chances of recovery is very high. Keep a mood diary. Why it is important? Because as we have seen during the premenstrual syndrome or menopausal symptoms, many times it's occurs in a certain phase of time only. So if you keep a mood diary, then it will be helpful for you to spot your pattern of your issues, and seek medical or professional help when needed. Let go perfectionism, which will definitely help you to improve, to reduce your stress. So flexibility in the life is essential. So remember that mental disorder is not, mental distress or disorder is not due to flaw in character or weakness of mind, but it is due to the flaw in brain chemistry, and it's curable with a proper treatment. So mental health is important for physical and emotional well-being of a self. Women are vulnerable during the times of hormonal change. So spot your early warning signs. Regular exercise, maintaining sleep cycle, balanced diet, and avoiding any type of addiction is essential for good mental health. You must seek professional help for mental distress or mental illness when needed. So if you keep balance in your actions and emotions, it will help to promote your positive mental health. Thank you.
Thank you, Dr. Swati. I think I will hand over to Dr. Mahamuni to introduce the chairperson, and then she will introduce the next speaker. We will take all the questions at the end since they're all linked.
Yes, ma'am. Thank you, ma'am. So now I will introduce our second chairperson. Before that, let me just share her biodata. So we have got second chairperson who is very young and dynamic, Dr. Smita Panse. Dr. Smita Panse is currently working as professor at PCMC's Postgraduate Institute at YCM Hospital in Pimpri. She has a postgraduate teaching experience of 14 years. So previously she has worked in BJ Medical College, Pune, then MIMH Pune, and also she has worked in SBKS Institute in Gujarat. She has 7 national and 3 international publications in indexed peer-reviewed journals to her credit. Also, her chapter on psychiatric aspects of unwed pregnancy has been published in a book titled Kumari Mata by Snehavardhan Publications. And she had won Best Paper Award in faculty presentation in Annual Research Society Conference in BJMC in year 2017. So over to Dr. Smita Panse for the next discussion. Thank you.
Thank you, Dr. Sandeep Mahamuni, sir. So it's my pleasure being on this platform and sharing this interesting session on women's mental health as we are nearing the International Women's Day on 8th March. So it will be my pleasure to introduce my former colleague at BGMC, Dr. Manjiri Datar. So can I have the CV, please? Dr. Manjiri Datar did MD Psychiatry from BJMC Pune, and currently she is working as Associate Professor of Psychiatry at Bharati Vidyapit Medical College in Pune. She has 15 years of experience in clinical and academic setups and has special areas of interest in community psychiatry and women's mental health with multiple research publications in these fields. She is a member of Scientific Research Committee at Bharati Hospital and is involved in training primary care physicians, community health workers in district mental health program. She has also conducted many stress management and positive mental health workshops and community awareness programs. So welcome, Dr. Manjiri, Looking forward to your presentation, and then let's have a nice discussion. Over to you.
Thank you for your introduction, Smita. And thank you all the organizers for giving me the opportunity to have my views on this very important and interesting topics on women's mental health. I will just start the screen sharing. Just give me a moment.
Manjari madam, you have to unmute.
Yeah, my screen is visible.
Yes, ma'am.
Okay. So today I'll be speaking on the obstetric and marital issues in a phase of life of women, that is in the youth. And I'll be speaking on multiple issues which a woman faces in the late adolescence and the early adulthood. Yeah.
Dr. Manjari, can you make it full screen, please?
Yeah, just a minute.
Yeah.
Is it full screen now?
Right. Go ahead. Yeah, please go ahead.
So, coming to psychiatric disorders in young women, like any psychiatric disorder, may it be schizophrenia, bipolar affective disorder, depression, or obsessive compulsive disorders, this we call it as major mental disorders, have the age of onset during late adolescence or early youth. And these are the years which are the productive years in any person's life. And when we come to a woman's life, the specific psychosocial issues which the woman faces in when she suffers from a mental disorders in her young years, they are very peculiar and maybe somewhat different and unique as compared to men. So any mental disorder which the woman suffers during youth, definitely the woman has a lot of academic and vocational performance, maybe during her college years when she is graduating or when she is in early years of her professional life. This mental illnesses usually strike, and this leads to a lot of impairment in these areas along with the functional impairments. Now, in a woman's life, a mental disorder has multiple complications. For example, medical complications. For example, any mental disorders like a major mental disorder like psychosis or schizophrenia, the patient tends to have other comorbid medical complications. For example, there is a lot of neglect. The woman can become anemic, along with comorbid endocrine disorders, which complicate her psychiatric presentation as well as the treatment. Our treatments are nowadays are very innovative, and we have unique molecules and very well developed molecules to treat these psychiatric disorders. But many we have to take into account certain adverse effects of the illness itself as well as the treatment. For example, the physical adverse effects. Many of our medications may lead to some metabolic changes, which may lead to weight gain, menstrual disturbances, and these have effects on the woman's self-esteem, leading to body image disturbances and maybe a low self-esteem because of it. And of course, when there is a young girl or a young woman in the family who is having a major mental illness, it leads to a lot of expressed emotions in the caregivers and in the family. So how to deal with her mental illness, and there are a lot of psychosocial issues which the family members of this lady they come across, and we deal with these emotions in our day-to-day practice. So I'll be sharing all our clinical experiences which when we deal with such women, and how their life goes on further. Coming to the most important life event in a woman's life, that is marriage. Marriage is actually a very happy event. But when it comes to a woman with mental illness or who is having pre-existing certain mental illness, there are multiple marital stressors which the woman undergoes. First, maybe like concealing the mental illness at all, which usually happens by the family members. There are multiple myths which are associated that if we get this girl married off, then maybe her illness can get cured, or it is the best treatment to get her married. Then there is a lot of stigma, like how can I tell that this lady or my child is suffering from a mental disorder? So suffering from a mental disorder, and that to a girl suffering from a mental disorder, is like a taboo, and it is a stigma to the family members. So all these psychosocial issues happen, like concealment. Then after marriage, it may be like already a patient of mental illness, or even if the female doesn't have any pre-existing mental illness, the marriage usually has a multiple stressors which the lady experiences, like adjustment issues in a new house, with relocation in a new house and adjusting with another members like her husband and in-laws, sexual dysfunctions, marital discord, and of course physical stress, like she is being exposed to having a lot of multitasking and multiple work responsibilities in her marital place. So we will discuss this one by one. So first I was discussing about the concealment of illness. Now, I would like to share my clinical experience that recently I have been treating this female who is a 22-year-old female. She had acute psychosis a couple of years back, and very brilliant little girl, and she was doing very well in her career, in her studies. And her after her I treated her psychosis, and she was apparently very well maintained on medications. And the parents were also happy that she is now becoming very much productive, and she has regained or resumed her normal life. So that routine psychoeducation follow-ups were being done for her, and suddenly they stopped following for the last 6 months, till the time 1 month back, when they just came telling me that we have got her married 1 month back, we stopped the medications, and now she has got a relapse of her psychotic episode. And unfortunately, many of her details were not revealed to the in-laws, which led to a lot of marital and familial discord, and it may lead to some legal issues. So this is a very common scenario which is experienced in their by psychiatrists in their clinical scenario, and we have multiple ethical dilemmas while dealing with such situations. So psychoeducation and appropriate education, that is what is a part of our practice, but still then such issues crop in, and we have to deal them ethically. So this is a common example after marriage or just before marriage, which usually is the scenario of patients with mental illness, women with mental illness. There are multiple psychiatric consequences after marriage. Marital and familial discord is a very common thing which we observe in our clinical practice, and this leads to multiple adjustment disorders. This is a very common diagnosis which we give in our clinical practice, that when a person, especially a woman who is like relocated in a new marital arena, then she is not able to cope with certain stressors in her life which are very new, and she lands up into symptoms of maybe feeling low, some irritability, she has mood swings or certain anxiety features, which is like which fits in a common group of adjustment related disorders. Frank depression is also what we commonly observe, like the woman recently married or in the early years of marriage is not able to cope with the stressors, along with there are multiple other life events which are occurring simultaneously, which concurrently lead to the diagnosis of major depressive disorders like depression. Anxiety, very commonly observed post marriage by us. There are also like certain somatoform disorders which we deal with in our clinical practice. And of course, as I said, that after marriage, there can be an exacerbation of pre-existing mental disorders, because marriage is like a significant life event and a stressor in a woman's life. So yeah, so again, I would like to share an experience of a woman married before 4 years with a 3-year-old son. And she suddenly started having these episodes of losing consciousness along with lockjaw and breathlessness. Now her in-laws, her husband, everyone were so worried, like how, what is this? Is she having a fit or something like that? They also like did a lot of neurological investigations which were within normal limits. Then they thought of like, okay, it is something like sort of black magic, तिच्यावर करणी केली आहे त्याच्यामुळे असं व्हायला लागलेलं आहे. So multiple sort of interpretations done by the relatives. And when she was referred to a psychiatrist by the neurologist, we delve into multiple stressors in this woman's life, like frequent verbal altercations with her in-laws, mother-in-law, and was inability to voice her distress, leading to intense anxiety. So the point to mention this case, like if it is just depression or anxiety, it comes into notice very quickly. But women can present with n number of clinical manifestations which are difficult to pick up. Like these are manifestations of certain psychological distress or disorders. Right, so we have to like notice and think of the possibilities of certain psychological etiologies behind the overt manifestations of disorders in women. Coming to sexual dysfunctions after marriage, this is a very less discussed area because especially like a woman, there is a lot of taboo to discuss sexual issues after marriage by a woman. So that way all these issues are not brought very frequently to our notice, but whatever cases we see, I am sure it is the tip of the iceberg, because sexual dysfunctions are very common in, especially in females, than they are thought. Now, these sexual dysfunctions can be desire or arousal type of disorders, orgasmic disorders, so or they can be pain related disorders like pain during the sexual act, it can be dyspareunia when there is a pain during the sexual act, or it is just vaginismus, which is because of the spasm of the vaginal muscles. So all these disorders can have a organic, that there is certain endocrine or structural lesion in the woman's external organs, or it can be psychological in origin. If it is psychological in origin, it has to be treated very like minutely, and we have to treat it in organized and a systemic manner to note down the exact reason and the intervention to be done. Coming to non-consummation of marriage. Now, these cases of non-consummation present like cases of pseudo infertility. Like usually they come to the notice of gynecologist that in spite of so many years of marriage, the woman is not able to conceive. And what happens that nowadays this sort of disorder is very common in the urban lifestyle, and the couples keep on suffering silently without disclosing their dysfunction to anyone. So it is not only the woman, but as a couple, as a dyad, they keep on suffering about it, and the consequences can be a lot in terms of depression and anxiety in that woman, as well as marital discord and multiple other familial issues. So getting these all sexual dysfunctions noticed is a very prime first investigation which needs to be done when we are assessing cases pertaining to the sexual disorders in the woman. So treatments, there are certain pharmacological managements for management of sexual dysfunctions in females. Therapy, it helps when we are sure that the dysfunction is psychological or it has psychological origin. We have systematic therapeutic approaches like couples therapy, marital and family therapy, along with sex therapy, where the couples are taught in an organized manner about their individual sexual, psychological, and other social dysfunctions. So the therapy is a very systematic process, but unfortunately, first the detection becomes a taboo and it is not disclosed, and psychiatric consultations are very reluctant. It is common to all, like all populations, may it be educated or illiterate or urban or rural population. So I think that is the area where we have to proactively work for the sake of awareness, to come and speak to mental health professionals like us. Coming to the next psychological issues in the woman's life is very distressing and important dysfunction, that is of infertility. fertility or bearing a child, conceiving is equated to being a woman. So womanhood is equated like she is able to procreate, she is able to be a mother, and she is able to take care of the family. And it is a fact that the woman feels complete, or it is a part of improving or maintaining her self-esteem to become a mother. So inability to conceive has a major traumatic consequences on the life of the woman. Now, the infertility can have multiple etiologies, may it be male or female factors, but it has been observed in studies that the psychological impact on the woman is extremely intense as compared to her husband. So it can lead to a lot of major psychiatric disorders like depression, stress, anxiety, even marital discord, and sometimes intimate partner violence. So these are like very traumatizing and distressing phase when the woman is suffering from infertility. And of course, her role in a family changes, or the dynamics in her family where she is living changes if she is suffering from infertility. And it has also been observed that nowadays various infertility treatments are available, and they are under regular treatment from infertility specialists. And during the periods, because sometimes these therapies require a lot of patience, and they are usually chronic and they have to be done for months or years together. So that period when the couple or when the woman is undergoing such therapies, that period is also intensely stressful for the woman. And it during that therapies or during the course of such treatments, the woman tends to have extreme anxious or sometimes depressive reactions, which have to be taken care of. Again, coming to like gynecologists or obstetricians usually see these women with bad obstetric history, which so-called, they call it as the women who are having repeated miscarriages or intrauterine deaths. So a woman, it is very traumatic for her not being able to give birth to her child in spite of conceiving. So miscarriages or losing an unborn baby, or just after birth losing a baby, is like a traumatic stress in that woman's life. And we also encounter a lot of grief reactions when the woman loses her unborn child or baby immediately after birth. So we have to be vigilant, and especially gynecologists, we usually like are in a hospital where we are in a liaison with and working with gynecologists. But sometimes in private setups, it may be difficult for the primary treating people to take psychological help for such women. But I think sensitization in these issues, like what the couple and what the woman undergoes when she is suffering from infertility, is a very important area in which psychological treatments can be given. So coming to the next phase in the woman's life, pregnancy. Pregnancy is again like marriage, a very, very happy event, and the woman's life changes topsy-turvy after the very good news which she and her family and her husband all receive in the family. So it is a very happy event, but as psychiatrists, we also deal with multiple mental disorders which have exacerbations during the period of pregnancy. There are a lot of hormonal fluctuations, plus as it is a major life events, there are chances that there are a lot of psychosocial stressors which the woman faces during her pregnancy, like for example lack of partner support or family support, or any abuse, or any change in her day-to-day routine, not being able to productively do her functioning, academic or professional functioning. So all these stressors are like usually faced by a woman in her pregnant life. And we deal with multiple these disorders like anxiety, depression, having sleep disturbances, very common, fatigue during pregnancy. And sometimes we also deal with patients who are having a lot of irritable outbursts to frank psychosis during the pregnancy period. Now, there are a lot of treatment dilemmas when it comes to like managing patients in pregnancy, because many a times we need to give drugs, because just managing the patients on psychological therapies may not be sufficient for that woman. because taking care of the mental illness is also a priority, because if the woman is psychologically stable or she is sound, then she can take care of her unborn child and eventually like have an uneventful and cooperate in her delivery process. So we have multiple challenges, because medications, they may have risk of fetal adverse effect, which we have to monitor. And of course, if the patient, the woman, if she is having obstetric complications like hypertension, diabetes, then it further complicates our management in these area. Again, managing the patient prepartum during her delivery, it requires intense support from obstetricians as well as the psychiatrists, and maintaining follow-ups of this pregnant women, because usually seeking doctors consultations, especially a psychiatrist, is sometimes difficult practically for the pregnant woman who is having mental issues. So these are the routine treatment related dilemmas as well as difficulties which we face in our clinical practice. Yeah, so I would like to share this patient who was 28-year-old, and this was her second pregnancy, and she was 36-year-old, and she suddenly had onset of this psychotic features, like she was hallucinating, she was irritable, she was not able to take self-care, she was not eating when she was like full-term pregnant. So we had like intense liaison with the obstetrician, because she could have delivered any time. And fortunately, like even in spite of her psychotic cognition, her hallucinations, we had to explain a lot about the treatment involved, like medications or electroconvulsive therapy if required. And we maintained liaison with the obs-gynecology team, and all together in the team of neonatology, obstetricians, psychiatrists, we managed her pregnancy and delivery to have, and we monitored the neonate for any complications. So in a liaison setup, this combined management becomes, it is desirable to have this combined management for such pregnant females who are having mental disorders. Now coming to a very important area, that is postpartum psychiatric disorders. After the woman delivers, the woman, there are chances, almost like 30 to 75% women suffer from this so-called as postpartum blues. Okay, so there are a variety of hormonal fluctuations, a drop suddenly in the estrogen and progesterone levels. So this affects our happiness, or this affects our happy or the pleasure hormones in our body, which may lead to postpartum blues, which are commonly seen 3 to 5 days after delivery. And the symptoms can be like tearfulness, mood lability, or sleep disturbances. However, they wane off on their own with good psychological support, taking care of the neonate as well as the new mother. Usually these postpartum blues goes off. The concern is when the woman lands up in a frank psychiatric disorder, that is postpartum depression, which can be seen in 10% to 15% of women. So the prevalence is quite high. So out of 100, we should like be vigilant if this woman is developing depression in her postpartum period. Usually it manifests in the first 3 months of her delivery. And the characteristics are, this woman, she has pervasive low mood. She is unable to like take good interest in activities. Now having a neonate is a very happy and I can say the most happy event in the woman's life. But she not being able to give proper attention to the neonate, not being able to feel happy about anything, having suicidal ideas, or feeling all negative ideas about the baby, may be seen within like for 12 weeks of this delivery, which is called as postpartum depression. Now, yeah. And there is a specific disorder which is called as postpartum psychosis, when the patient has like thoughts of harming the baby along with ideas of guilt, inadequacy, which can be there. Postpartum psychosis can be seen in 1 to 2 deliveries per 1,000 within 8 weeks of delivery. So psychosis is a very severe condition which is characterized by fatigue, insomnia, restlessness, along with suspiciousness. So this suspiciousness can be very irrational, like the baby is deformed, feeling to harm the baby. So these are extremely irrational thoughts which can come into the woman's mind. So treatment of these postpartum psychiatric disorders, it is like postpartum depression or postpartum psychosis or mood disorders, is an treatment emergency from our side, from psychiatrists. What happens, like the relatives feel that the woman is overwhelmed by the stress, or she is like changed her role as a mother, and that is why she is behaving something absurd, or she is not taking the care of the baby, and that is why many of these women are neglected, or they are criticized, or a lot of they face irritability from their family members. But it has to be remembered that it is a mental disorder which is caused by certain chemical imbalances or neurotransmitter imbalances in the brain because of the hormonal imbalances, and it requires an intense management from the psychiatrist. So we have medications, we have other therapeutic modalities like electroconvulsive therapy and other management, in which we maintain a close liaison with the obstetricians, neonatologists, and pediatricians to monitor the baby as well as treat the mother. So any postpartum behavioral change or the mood or emotional change in the mother should be treated like an emergency, because this is going to affect the health of the newborn baby. Neglect from the mother or any malnutrition at this stage in the neonat's life can have hazardous consequence on the neonate, and it can affect the mother. Even the bonding of or rearing by the mother is affected if her mental illnesses is not treated efficiently. So there should be a lot of awareness as regards to these postpartum psychiatric disorders. They are very common, but again, coming to the notice of psychiatrists, we again see a very low number of patients, because they are maybe not treated adequately. So prognosis is good if in the postpartum period, if the woman is having any psychiatric disorder, may it be depression, psychosis, or any mood disorder, if they are timely treated and adequately treated, the prognosis is quite good. Again, after this, we have to take care of the breastfeeding. If the woman is on medications, we advise certain caution for breastfeeding. So it depends upon case to case. But again, lactational issues are also dealt with by mental health professionals, which we usually do it in liaison with our obstetricians. So finally, after covering all the points from the woman's youth, the take-home message is that marriage, pregnancy, childbirth are significant stressors in a woman's life, and especially in women with mental illnesses. There are significant life events which predispose to these mental disorders, and timely management, it has to be a liaison management with the team of professionals, including psychiatrists, psychologists, obstetricians, pediatricians, can lead to effective remission of all these disorders. These are my references, and thank you for your patient listening. Thank you. Thank you very much.
Thank you, Dr. Manjiri, for your wonderful presentation, which covered the entire concept of women living with mental illness throughout their life, with various psychosocial stressors as well as biological vulnerability. So now the forum is open for discussion. In the chat box, I can see one question by Dr. Bhalchandra Karme: how to address perimenstrual blues, irritability, anxiety, any pharmacological management? Dr. Manjari.
Okay, so perimenstrual dysphorias is what the condition is. Usually, like some females, just before their menses or on the day of menses, tend to suffer from dysphorias, which may include mood swings, irritability, or just feeling tearful or feeling low. So in such cases, we have to carefully weigh the situations. Sometimes it may not require pharmacological management, but there are multiple drugs, like which we call it as selective serotonin reuptake inhibitors, like drugs, which can be given to a woman. And usually we observe that if the dysphoric disorders are severe, they have a very good remission if we treat them with medications, as well as certain stressors which are there during menstruation. If they are addressed with the team of psychologists, there is usually a good remission of these symptoms. But we usually, preferentially treat when these dysphoric disorders are severe enough to cause functional impairment in that girl or woman.
Right.
Yeah, there is a question by Dr. Sharmila Kubde. I think this is for Dr. Swati Joshi. How to keep the emotional balance during menopause?
So during menopause, there are lots of physical and psychological changes are happening. You have to assess the situation. If there are any stressors, then you have to work on that stressors also. If that woman is having significant depression, means having an impact on her working efficiency, then you can think of starting antidepressant for her. Otherwise, counseling session will help her to deal with her emotional turmoil, or when she's having any stresses that can be dealt with.
I think the next question either of y'all can answer, by Sujata Bajpai. Why tension headaches or migraine are more prominent in women? Please give solutions.
Okay, so migraine is it is on the brim of like neurological disorders as well as the psychiatric disorders. Now there is a psychosomatic origin for any psychiatric disorder. Like if there is like whatever stressor, if a person is facing, especially a woman, then there are certain changes by which the brain perceives those stressors, and it leads to certain manifestations of physical symptoms. So these psychosomatic illnesses, what we call it as, so the manifestations of these psychological disorders, the underlying disorder can be anything. It may be depression, it may be anxiety, or it may be just facing a stressor, an emotional stressor. And we all know that emotional, stressors are there in everyone's life, but the emotional coping response is more prominent in women. And when these stressors are usually translated into somatic symptoms, because brain is the organ of the body which deals and controls every other single organ of the person's body. So it may be headache, sometimes it can be related to the heart, like palpitations. Sometimes the manifestations can be towards the abdomen, like abdominal pain, or sometimes tingling in the legs. So definitely, like because the stressors are manifested in sort of these somatic symptoms, and the most common somatic symptom which is experienced as a manifestation of maybe depression or anxiety is headache. So we have to carefully rule it out. Migraine can be caused because of constriction of the vasculature which supplies the frontal areas of the brain, which leads to very typical symptoms. But definitely migraine is also precipitated by certain psychosocial stressors. So the treatment of migraine also involves a lot of psychosocial techniques and cognitive and behavioral treatments which can be given. So the link is not so simple, but to explain that the mind and brain are brain and the body are very much connected. So anything which happens to your mind, its manifestations are going to be on your body. I hope this answers.
And we also have menstrual migraine, which is actually related to the falling levels of estrogen. So the hormonal fluctuation also can precipitate a premenstrual menstrual migraine, which subsides with the onset of menses and by the third day or so. So I think Smita can ask the next question.
Yeah, I think someone has, Shweta Thorat has asked how to keep low temper while working from home. Maybe Dr. Swati Joshi would like to address, since her topic was the entire physiology of women's life starting from menarche to menopause. So any quick solution for this, I would like to really know.
Just a minute. Can you just repeat the question?
How to keep low temper while working out at home? Working out, I think working from home, it's meant.
Nowadays, due to corona epidemic, many people have to work from home. So there are lots of family dynamics going on around it, because whole family is at home, and then female has to balance everything, starting from home management, kids management, and her own work. So you have to prioritize your things, and then you have to also delegate certain tasks to the other family members also, so your burden on you will be less. And
totally agree with you, madam.
Yeah. Yeah, because otherwise female means woman just go on doing things, and other won't realize that there are lots of work in the house also, and it makes her more stressful. So if you delegate your work to other family members also, depending upon their capability, then your work stress or workload will be less as far as the home management is concerned. And then you have to means schedule day-to-day routine, because nowadays we are seeing kids are getting up late, then everything just go on late, and then the who is the working woman, she has to adjust according to others' timings. So if that day-to-day routine is maintained by everyone in the family, then also the stress on her part will go down. And then you have to means look for your daily diet, exercise, because exercise also helps in reducing your stress by increasing the level of endorphin. Anything else you want to add, Manjiri?
Yeah, of course. As rightly pointed out by you, ma'am, like this is the very daily like suffering which every woman is currently undergoing, multitasking at home, taking care of all her family responsibilities along with the professional commitments. But all what I can say is that all women should perceive it, maybe strain. Strain is a part of life, but stress is how you perceive it onto yourself. So in spite of strain, if you are trying to enjoy and maybe prioritize your commitments without thinking it as a mental stress, then you are like probably you are probably less distressed because of such multitasking, and maybe at an enjoyable level that you are able to deal with so many things one at a time. So sometimes applauding yourself for doing multiple things on that particular point of time is also like should be done by all the women who are definitely doing multitasking in different ways.
Okay. We have another question by Sujata Bajpai, whether PCOS due to mental health disorder. Anyone can answer. I think it could be Manjiri or it could be Swati.
PCOD leading to a mental disorder.
Mental disorder, or PCOD due to a mental health disorder, but that can, I think either of you all can clarify. Just before you all start, I wanted to tell the delegates who are watching in, the sessions will be available on the YouTube link, which will be posted on the group chat. So I think it will be posted by the hosts. Yeah, go ahead, Manjiri. You can, or Swati, whatever.
So PCOD is a very common disorder, gynecological disorder, which is there in girls, women, married or unmarried. And currently our institute is doing a research on this aspect as well. So PCOD leading to mental disorder may be because of certain secondary stressors which are there because of this PCOS syndrome. Like in a girl's life, PCOS is like having a multitude of other disturbances like weight gain, hirsutism, when there are a lot of hair growth on external visible surfaces of her body, and weight gain or disfigurement is also like a part of the syndrome. And of course, when such disfigurement is there is a lot of impact. The body image disturbances can have a lot of impact on the woman's emotional status, which definitely can lead to certain emotional issues in that girl or a woman. And definitely, as per the consultation of gynecologist, usually PCOS is a very common cause of infertility. So a woman knowing that she is suffering from a disorder which can probably lead to infertility, or after marriage, my infertility is because of this syndrome, definitely has an extreme negative emotional impact on the woman's life. So definitely we are observing a lot of mental disorders pertaining to depression and anxiety in women who are suffering from PCOS. Even if they are not married, knowing the diagnosis that the woman girl is suffering from PCOS can be extremely traumatic to her also, and maybe to her family members also, especially mother.
Yeah, Manjari, I would like to ask, is the incidence prevalence of PCOD increasing in our society, and what are the reasons?
I can't comment on that, but our students in our institutes are getting a lot of PCOS patients, especially who are consulting gynecology OPD. So we are proactively screening these girls who are suffering from these disorders, and definitely we are getting multitude of those patients. I can't comment on the numbers, but whatever we are dealing with, we are getting many females, because we are proactively screening them. On their own, they are not much proactive in consulting a psychiatrist for their mental issues. But yes, if we go and screen them, then we find that these PCOS are having a lot of issues, and we are seeing multiple of them when we are screening them.
Just to add to that, I think one important part is we are detecting them more, because earlier maybe I think the menstrual irregularities were kind of accepted part of women's life. So nowadays, with I think better technology and better awareness, people are getting consultations earlier, and also community drives are helping to realize that PCOS is quite common and can lead to many mental health issues later on and even gynec issues, so needs to be treated. So maybe that is one more detection is also reason for more diagnosis. And then Dr. Swati madam said, the menarche, the age is going down, the because of better health, sanitation and everything, the lifespan has increased, and overall even the fertility phase of women have increased. So that may also be one of the reasons of various hormonal changes which may be responsible for more PCOS.
Sedentary lifestyle is also that is
yes,
considered one of the reasons.
Yeah,
obesity.
yes.
Right.
Which is
Right.
also
Actually, the question was whether PCOS is due to mental health disorder.
No, that's all right. We are
Mental health
discussing.
disorder cause
Yeah,
I don't think that association is right, because we don't see secondary PCODs in mental disorders. It may be an association.
Yes.
Yeah, but good lifestyle changes help us to not actually prevent, but bring the girls out of this distress, or reduce the impact of mental impact of PCOD. Lifestyle changes.
Yes, definitely, madam. Because in one way, when mental health disorder, the treatment part, where we always are on the lookout for the metabolic syndrome with the newer drugs which can lead to weight gain, and where we have to encourage the lifestyle changes, because here we have to see if the patient is overweight, and then secondary to some drugs, there may be increase in incidence of PCOS. So indirectly, mental health disorder treatment can sometimes lead to PCOS if it is not monitored properly.
Yeah. There's another question by Seema Rathi about, I didn't understand the question. It's urine frequently. I mean, is it that
Maybe some typo.
Yeah, I think what she means to say is like polyuria, like frequent urge of urination. It can happen in women, which may be related to certain gynecological disorders like infections which in the urinary tract can manifest as polyuria or increased frequency of micturition. And from psychiatrist's point of view, any anxiety disorder can manifest in the form of frequent urge of urination. So, if the patient is quite anxious or having certain overwhelming situations to deal with, there are chances of suffering from polyuria. But definitely, gynecological causes are prime. Any infections or any local or any urinary or renal pathologies can also lead to these symptoms
in
of
diabetes?
increased frequency of micturition.
Yeah, and during menopause, there is a laxity of bladder muscle that also
Yes.
increases the frequency of micturition.
Yes. I think we have come to the end of the questions. So again,
I
Yeah.
would like to ask Manjiri, just for the benefit of our viewers, Manjiri had mentioned body image disturbances are they increasing? I would like to ask again. Seeing that we now see like slender women and very thin women have become the ideal. So are girls falling into that body image bracket and getting more mentally disturbed? What is your reading? Jyoti, I think you can also comment.
The body image disturbances which I had mentioned was in relation to the treatment of mental illnesses when initially the woman was like having this sort of weight, and after treatment maybe there is a lot of weight gain leading to a lot of like drastic changes in the body image. But yes, apart from that factor, usually females like because of extensive exposure to media and so-called a normal typical female which is described being beautiful or being like in a particular figure is treated as a it is like observed as more feminine. That can be a perception in girls, but fortunately, like with a lot of awareness and education, that factor of the maintaining that body image or maintaining that physical structure, especially in women who are now so much aware and perfect in their particular fields, professions or otherwise also. I think this has taken a backseat, but definitely because of a lot of exposure of media and a lot of obsession with apps like Instagram and social media, having that perfect figure, displayed perfect figure on these particular platforms has become an obsession in young women, especially like college going or typical late adolescent females.
In fact, we had done a study a few years back. It was with regards to a school mental health program. And we had seen that adolescent girls more than adolescent boys in high school actually did have body image disturbance correlating with a lower self-esteem. And of course, this was also linked to the fact that, there's much more exposure via smartphones and social media apps, as Manjiri said. So yes, there is a link there. And but of course, on the other hand, there is also a lot of body positivity that comes up, especially for young women, in terms of there are lots of blogs, for example, or people talking about body positivity irrespective of what your weight is, and it's about being healthy actually, which is much more important. I think we have come to the end of all the questions. Are there any more? Anyone has think? Because
Well, shall we stop the live streaming?
yeah, I mean, if you want,
I have to give the vote of thanks.
Yeah,
Just to conclude. Yeah.
I think you can straight away go to vote of thanks, but this has been a very informative session. I think our viewers have benefited a lot by the information given by our esteemed two speakers and the very enriching contributions made by our chairpersons also. So viewers, friends, all our friends who have joined us today, I would just give them the take-home message that yes, we have to accept ourselves as we are. We have to become mentally healthy, take every situation in the right perspective, because as Manjiri has said, with every happy moment in her life, a woman is surrounded by a dark cloud out of which she has to come out very smoothly. She can do this if her mental health is prepared enough, and she is ready to replace her negative emotions with positive actions. So we will, on this International Women's Day, let us all make a promise to ourselves that yes, women are a symbol of strength. We are going to be strong enough. We are going to take charge of our life. And yes, we are going to create a beautiful world for ourselves with a beautiful mind. Thank you very much, all viewers, for joining us. And Sandeep, please give vote of thanks now. Thank you.
Okay, so so this year's theme of Women's Day is Women in Leadership, achieving an equal future in COVID-19 world. So I'm sure the information given by both speakers and inputs and insights given by both the chairpersons will definitely help audience to stay mentally healthy. So I thank both speakers, Dr. Swati Joshi and Dr. Manjari Datar, for lucid presentation and giving a lot of information about women's mental health issues. I also thank both chairpersons, Dr. Jyoti Shetty and Dr. Smita Panse, for wonderfully conducting question and answer session and giving a lot of insights about the same topic. I also thank all audience for patiently listening the program. And lastly, I thank Intas Pharmaceutical and the representatives of Intas for helping us conduct this program unconditionally. And I hereby declare that this program is concluded. Thank you and good night all.
Thank you.
Thank you.
I think we can stop the live streaming.
Yes, Manjiri, Dr. Swati, thank you very much. Jyoti and Smita also.
Thank you, madam. Thank you for giving the opportunity.
Yeah, and thank you, Intas, the office bearers, for being our technical and academic partners today. Thank you very much.
Thank you, ma'am.
Thank you very much, everyone.
Thank you.